We're just about ready to get started, so if everyone would like to take their seats, please. Well, good morning, everyone, and welcome to the Low Income Health Program Conference, which is supported by the Blue Shield of California Foundation. We'll be focusing on our activities. We are at the forefront. LIHP Transition prepares California for healthcare reform. My name is Jalynne Callori. I'm Chief of the Low Income Health Program Division in the California Department of Healthcare Services, and this is the third LIHP conference that I have had the pleasure of organizing, and it's nice to see so many LIHP administrators and community stakeholders here today. We're joined today by a range of individuals who, in addition to the LIHP administrators and the community stakeholders, of state-level policymakers represented by their staff from the Centers for Medicare and Medicaid Services, and staff from a variety of California state departments, including the California Department of Public Health. We're also joined today by viewers through the internet who are listening to presentations over a live webinar broadcast, as well as viewing the information we have up on the screens. I do want to let our webinar participants know that if you have any questions for our speakers, please send them to liptransitionproject@dhcs.ca.gov or to our event planner, GACI, Katie in particular, at katie@gacinstitute.org. That information is also in your packet, but for individuals who are listening in live, I'll be repeating it a few times during the day. We will respond to your questions that you submit by email or an FAQ document after the conference. For participants at the conference, you may use the cards on your table to jot down questions regarding today's topics and then place them in the box that we have identified outside on the registration table. And we'll respond to those questions as well through a FAQ document after the conference. Now I need to give you some housekeeping items. Restrooms are located in the lobby outside the conference room. The lobby is down the hall and to the right. So feel free to ask directions, and it is kind of a walk. Okay, maybe many of you have already noticed. We will have periodic breaks throughout the day, but feel free to take an individual break anytime you want. In room 305, which is just right across from this room to the right, we have outlet. It's a room where the participants can go. We have outlets and tables and chairs if you need to charge a cell phone or have impromptu meeting. Please remember to mute your cell phones and Blackberries. And if you need assistance for any reason, please ask our staff that you'll see floating around the conference room with either red staff badges or the purple LIHP staff badges. Then I'm reminding you that for today, you're going to be on your own for lunch. The Sacramento Convention Center has provided area maps for restaurants that are close to the convention center, and they are in your packets. And during the lunch break, if you have luggage or bags that you'd rather not carry around, you're welcome to leave them with the registration staff, and they will lock them in, I think it is room 301. And this is also during the break. In your packets, you'll find the evaluation form. So by the end of the day, if you could please complete that and leave it at the registration desk, we are very appreciative. It helps us plan future meetings and conferences. I'd like to take this time to thank the Blue Shield of California Foundation. Their generous sponsorship of this conference enables us to actually be here today. And I'd also like to thank the planning staff from DHCS. It includes Bob Baxter, Kim Swift, Melissa Simons-Williams, Gloria Petrol, Allison Sawyer, Brian Hansen, Alan Roche, and Dr. Dylan Roby, UCLA Center for Health Policy Research, and our event planners, Government Action and Communication Institute, or GACI, for all of their help in putting the conference together. So it is now my pleasure to introduce Richard Thomason from the Blue Shield of California Foundation. Richard serves as Director of Healthcare and Coverage Program at Blue Shield of California Foundation. Previously, he served as the Health Policy Director for SEIU, as a consultant for the Assembly Health and Assembly Insurance Committees, and as staff to U.S. Senator Bill Bradley. Please join me in welcoming Richard.
Great, thank you, Jalynne. I too would like to thank everyone for coming here this morning. We, at the Blue Shield of California Foundation, we're really proud to be able to support this conference and the last several conferences on the low-income health program. And we've been very pleased at the success that I think we have all had with the low-income health program. I just want to take this moment to note that that through the program and through the waiver, the state of California has enrolled over 600,000 previously uninsured and low-income folks into coverage, leading up to the Affordable Care Act implementation next year. I think we're still more than the rest of the country combined, so that's due to all the hard work of the department, the partnership with the federal government, and all of the hard work that you all have put into this over the last several years. So I want to thank all of you for everything you've done to really improve care for people in your communities. So thank you. So we're definitely pleased to have the conference today. We think it'll be a great opportunity for all of you to think about the transition issues still to come and how you all can help work through them at the local level and work with the state and federal government on the remaining issues. There's only 138 days left till January 1st, but who's counting? So no pressure. But I think we'll have a really robust discussion today of a variety of issues, a variety of learnings from some of the other Medi-Cal expansions that have taken place and managed care expansions, and really do urge you to stand up and ask questions. This is really your opportunity to talk through the issues that are taking place in your communities and your county, and really dialogue with the state for some answers. Now, we're also starting to think about the future a little bit at the Blue Shield of California Foundation. We have been strong proponents of expanding coverage, expanding access, and transforming the delivery system in California for safety net providers and for low-income Californians. So we're really interested to be thinking with you all beyond the LIHP transition about what next for local coverage programs, what next for the LIHP infrastructure that you've created, what next for your medically indigent adult programs as you think about how your county is going to be taking care of folks moving forward. So I just want to close by urging you to keep us in mind as you're thinking through those opportunities and those options. Please contact us if you have questions or opportunities or ideas that you'd like to run by us, because we've been very proud to partner with counties across the state on the LIHP development and implementation, and really look forward to continuing that dialogue with you so that we and you can work together to think about how you can best continue to serve folks who will be uninsured even after ACA implementation kicks in next year. So with that, I will close and turn it back to Jalynne.
Thank you, Richard. Now I'd like to introduce Toby Douglas, who's the director of the Department of Healthcare Services. It's through Toby's vision and leadership that the low-income health program was created, and it now serves as a national model for statewide healthcare programs to low-income individuals. Toby?
Thank you, Jalynne. Good morning. It's a pleasure to be here and see familiar friends from the counties. What I first just wanted to remind everyone, back in 2010, when we embarked with our county partners and with the legislature and our federal partners, we laid out a vision to be an early implementer of the Medicaid expansion. And we set really ambitious targets. At the time, we laid out that we were going to enroll 512,000 Californians in this program by the end of 2013, that we were going to get 54 different counties up and running with the Medicaid expansion. And through the conversations both with our federal partners and others, that continue to come back that seems ambitious, that seems, are you sure you're going to meet those targets? Well, look where we are today. 600,000 low-income health program participants in the program in 53 counties. Just amazing what California has done, and that's not just from the state, that's because of our county partners, that's because of the working closely with all other stakeholders, including our foundations and our federal partners as well. So at first, just want to commend all of you for showing how California can set ambitious goals, be a leader, and achieve beyond what we set out. And I think that's where, as we look to the future in 2014, I think that's going to continue to be the theme for California. So what have you all done? I think some of the key pieces, and we see that as we look to 2014, as you have been leaders in coming up with innovative approaches for eligibility and enrollment, and ways that we can both do in-reach, do outreach to quickly enroll populations into the low-income health program, which is why we're already at 600,000. You have done work on creating stronger patient-centered medical homes, of working closely with the broader medical and social and behavioral health system. You've also looked in some counties at ways of bringing in different mental health services and substance use services into the system. And all of these, as we look to what we've achieved with the legislation that the governor and the legislature enacted, are key ingredients. We are now implementing the Medicaid expansion and moving forward with the transition of the LIHP program. We're bringing in an even more robust benefit package that is consistent across all populations, with stronger mental health benefits, richer benefits, as well as a richer way of substance use services. And all of that is founded on patient-centered medical home, that we are bringing in managed care throughout the state, that we are now moving managed care into all counties throughout the state. So as we look to the transition of the low-income health program, we'll be able to move them into managed care and to be able to connect them to a delivery system that provides comprehensive coverage. So there's a lot going on to get us to 2014. Biggest pieces, of course, are our transition of the low-income health program into Medi-Cal in 2014, which is why you're all here today. And that is a key success marker of our success on January 1st. If we can transition those 600,000, shows how California right away is a leader in healthcare reform. And there are a lot of pieces to it, and I know we've put together our transition plan, and there's a lot of work to go down in the details, and I hope these 2 days, yesterday and today, allows for us to continue build out that work plan, because it's not going to just be the state to execute. It's the state working with the counties as well as all other stakeholders to make sure that we're clearly informing the low-income health program participants about this transition, that we're working on the data and the IT system transitions within systems. We're working on the continuity of care so that we can connect them and keep them with as much as possible with the same provider. We're looking at ways for those special need populations to connect them to mental health services, to HIV and AIDS, and other special needs services. So that's going to take a lot of work, and that goes into different levels. And the next step is really our work on transforming the whole eligibility delivery system from the very paper-intensive system focused on assets, mid-year status reporting, to a system that is streamlined, modified adjusted gross income, where there's the opportunity for individuals end-to-end to be able to enroll electronically. And that is a transformation both as it relates to working with your county social services partners. It's a transformation working out for application assisters or enrollment counselors. It's a transformation for the consumers to have how they can get onto the program. And there's a lot of work going on. First is our work on the CalHERS development, the whole new eligibility enrollment system, which will connect with the county SAWS systems. And It is an ambitious IT project that normally would take 3 to 4 years. We're condensing into about a year. And we're going to have to, we're going to work through this, but this is a centerpiece to get healthcare reform up and running, both for those available for covered California and advanced premium tax credits, as well as those available for Medi-Cal post-2014. The other big piece, as I noted, is our benefits. We're working on expanding both substance use disorder services benefits, as well as mental health services into managed care. And those will both be up and running on January 1st, and will complement for the low-income health program transition, as well as for current Medi-Cal beneficiaries, the opportunity to have a comprehensive array of services. So we look back at 2010, and we took many ambitious steps, and we set our sights really high to achieve, to be a leader in early implementation of healthcare reform. Well, now we got to take those successes and move it to the next level with all that's ahead of us. And looking at what we did and where we've come, I know with all of you and with our federal partners and other stakeholders, we'll get there. So thank you so much.
Okay. We also have a very real honor today to have the Secretary of the California Health and Human Services, Diana Dooley, with us, and she'll be offering some insightful insightful comments to us all. Thank you.
Thank you, Jalynne. I'm really glad to be here, and I think I was here last year. I don't know if I was here at the first one, but I have, as you might expect, a lot of people that want to talk to me, and I choose where I go from what I can also learn. And I have been very inspired and educated by the work that you are doing, and have appreciated the opportunity to hear from you, which I look forward to doing in our question and answer period here this morning. But I came this morning mostly to say thank you. Thank you to all of our county partners. This is a huge lift, and it started in 2010 before I came in January of 2011. And I have often said, and I will say again now, that one of the ways that California has been a leader and the way we can make life better for so many Californians is because, unlike all the rhetoric we hear around the nation on this, we are so lucky, and I am personally appreciative of the fact that in California, healthcare reform hasn't been a partisan issue. We haven't been divided in the way that the rest of the country has been divided, and that has given us a platform and an opportunity to do really good work for people who need it so very much. We took the baton from a Republican administration in California. There was a Republican governor that started this and created the low-income health program and created the health benefit exchange that has now covered California. And we took that baton in January of 2011, and we have continued the race to make life better for people in California. And it's an often missed reality of why California is in the position that it's in. We lock arms and we solve problems. And the governor certainly made that commitment early on to solve our budget crisis. We tried to make that bipartisan. That didn't work quite as well as healthcare reform has. But we did reach out directly to Californians who saw the future of California in a united way and said, we want to make life better here. It is, I'm very humbled by the work that you do. We're standing on the shoulders of people who have come before us, and our goal is to make life better for the people who come after us. There are many parts of this, and Toby certainly laid out the transactional activity that we have here, but it is also fitting into a broader framework of healthcare reform. Clearly, most of the attention is around the coverage expansion, and that is what you're about and what we're doing at Covered California. But that is one leg of a three-legged stool that the ACA gave us tools to do. The other two are delivery reform and wellness and prevention. And we are very committed to working in those areas as well. We just began our transition on payment reform for the hospitals with moving to DRG, which is diagnostically related groups, and moving away from fee-for-service systems and having bundled care and outcome orientation to our payment. And in health and wellness, we did some very good work last year with our Let's Get Healthy California Task Force, and that work is continuing, and we've set some ambitious goals there. So what you're doing fits into a broader framework of trying to move to a system of health instead of a system of illness, encouraging ways for people to be healthy, both through the delivery of care and the delivery system improvement program that was a part of the 2010 waiver, and more broadly throughout the commercial market with the work that we're doing with our purchasing active purchaser, which was a tool in the Affordable Care Act that few other states have picked up and used, but we are very active using that tool at the Covered California to set standards for our plans that will be uniform, and to create information on our website that will allow people to compare apples to apples in benefits and providers and outcomes and quality as we build that out. So we are moving on a lot of fronts. It's very difficult. This lift is very hard. We're changing so many things, as you know better than most. We're bringing two very different products together in a streamlined, uniform enrollment and eligibility system. We have a program to which people are entitled if they meet certain requirements, and we have a product that people can buy with help through premium assistance. Those two processes have been completely independent in the past, and we're trying to bring those together in no wrong door approaches to single portals through our website, and the integration of county eligibility workers and community enrollment counselors. I've tried to get away from the application assisters. They're enrollment counselors now. So these are really, really gargantuan efforts that we're going to make a lot of mistakes as we go forward. We have done an extraordinary job getting here. When we started to build the electronic system, the IT system, we didn't have very many bidders at the exchange because very few people thought it could even be done in 18 months. We have worked very closely with our partner Accenture, and we are very, very close. We're not going to have all the bells and whistles. It's not going to work as smoothly as we would like at the beginning, but it's going to work, and people are going to have access to information. But now more than ever, we are going to have to stand together and give each other space and accept each other's apologies and offer some forgiveness as we struggle to make this work as we go forward, and recognize that we're going to have to do a lot of learning and a lot of regrouping and a lot of adjustment as we get out into 2014 and beyond. But we are very, very well positioned to get this started. Most of that is, or a great deal of that is due to the work that you have done through the low-income health program in creating that atmosphere throughout California that this is the right thing to do, and we're going to make lives better for so many people in California. So I'm very happy to spend an hour with you this morning. I wish I had more time, but I'm very grateful for the work that you're doing, and I look forward to being informed by some of the questions and issues that we talk about in our question and answer period. So thank you very much for your work.
Okay, our final welcoming speaker this morning is Dr. Gloria Nagle, who is the Associate Regional Administrator for Medicaid and Children's Health Operations at the Center for Medicare and Medicaid Services in San Francisco. Gloria works with 4 states and 3 U.S. territories, overseeing the provision of technical assistance and directs financial and program monitoring of the Medicaid program and Children's Health Insurance Program. She and her staff are prime partners. So, thank you, Gloria.
Thank you, Jalynne. And I actually need visuals, so I'm the only one here with the PowerPoints. Apologize, but I need to have something to look at, and hopefully it'll be helpful to you also. First of all, I want to say I'm just thrilled to be here to talk with you about the LIHP, which is a program that we're very proud of also. And as far as my presentation, I think you could just sort of consider the agenda being I'm going to start by gushing, putting in a dose of reality, and then end by gushing again. So with that, let me see if I can get this clicker working. I got some instructions. I just went through what I was going to do, so we don't have to do the agenda again. But I do want to talk, this is probably the core of the slide here, and I want to say thank you to the UCLA researchers that did the interim report on the LIHP program. I copied this all from what they have put in their report, and I don't know how many of you have had a chance to read that report. It's really informative. But some of the key points is just to look at what you've all accomplished in a couple of years. It is truly amazing. When CMS worked with the state of California, approved the LIHP as part of the Bridge to Reform waiver in November of 2010, we were working with a demonstration project that was in 10 counties and was nowhere near the developed to the extent the LIHP has. There was no court set of benefits, and again, it was in 10 counties. The state had presented the proposals to expand this as much statewide as possible, and as Toby had said earlier, they were expecting about 500,000 enrollees in the program. And look at what was reported in the report that came out from UCLA recently. As the estimate, you have enrolled nearly 700,000 individuals in the LIHP program. That is an amazing feat when you look at, I think people were just hopeful to think there would be 500,000, and you've actually gotten up to 700,000. You are now in 53 counties, and there's a core set of benefits that are provided, particularly to the MC part of the LIHP. So in a couple of years, it's just amazing. As you said, just you can really gush about what you've accomplished in that area. So, jumping to 2014, why is that so important to us? I mean, we call this Bridge to Reform, and what exactly does that mean? It really, the LIHP is one of the best examples of a true bridge to reform, because in January, at the state's option, which California has opted to do, states can expand their Medicaid program to basically include in their regular Medicaid program the population that you have enrolled in Medicaid as a demonstration program. So as part of the demonstration. So what's going to be happening as of January 1st, for the first time, states, without going through the waiver process, can add all low-income individuals, which basically will be the childless adults, into their regular Medicaid program, what we call a state plan population. So anyone with income below, we say 138%. I think people get confused. What that means is, officially, you will see people with incomes under 133%, but they get a 5% income disregard. So we commonly refer to this population as, with incomes under 138% of the FPL. So what will be happening is the LIHP waiver population will be moving over to the state plan, and what is now where the county is basically funding it at 50%, the state will be getting 100% federal match for this population for at least the first 3 years. It'll start going down, but it won't get any lower than 90% by 2020. The last part of this slide